Well, good morning, Queensland. I can report that we have 2 new cases in Queensland, one overseas acquired and in hotel quarantine. The other one, we put a release out late yesterday afternoon, relates to a 4-year-old girl who is a close contact of the truck driver that lives at Windaroo. We have now identified that this young child was infectious in the community from the 31st of August up to the 2nd of September when she got tested, but we believe infectious for the 2 days, as in she was out in the community for 2 days. She had been at daycare at the Boulevard Early Learning Centre, and there are children at that learning centre that also go to Windaroo State School but use that early learning centre for before and after school care. Consequently, both of those two sites have been put into quarantine. We also are concerned about the fact that this driver with the child went to the Beenleigh Marketplace on the 30th of August and to the Stylish Nails Salon inside the Beenleigh Marketplace. So we are calling on anyone who has been at the Beenleigh Marketplace between 10:30 and 11:45 to go and get tested and await your results. If you've been to the nail salon, you are required to quarantine for 14 days. Before I go on about those details, can I say this obviously brings us to 20 active cases currently. We had 9,996 tests yesterday, so again we'd like to see high numbers of tests, particularly in the Logan and Beenleigh areas over the weekend, and we have many sites opened over the weekend and private pathologists being set up. We had 20,635 vaccinations, so well done everyone again for coming out and continuing to be vaccinated, which puts us at 52.17% first dose and excitedly 33.55% second. That means a third of all eligible Queenslanders are now fully vaccinated. So let's keep that great work going and coming out and getting vaccinated, jumping on the website, getting registered with Q Health or booking in with the GP or going to a community pharmacy. Now, in relation to the risks, obviously Q Health are doing the close contacts for the early learning centre and the school, but we do want to put a call out to anyone who's been to the Beenleigh Marketplace and particularly the Stylish Nails Salon, that you must come forward, you must get tested and you must isolate. Sadly, what we have seen is that people were not checking in. There was one person during that time checked in with the check-in app at the nail salon, but we know there was at least 8 customers there in addition to this gentleman and the child, and of course 4 staff. So we do need people to come forward because we can't rely simply on the check-in app data because people haven't been checking in. So this is a good reminder for everyone. Businesses and individuals all have a responsibility to make sure that people are checking in. Businesses should not be letting people enter their premises and sit down or participate in activities or shop around without making sure they've checked in first. And as individuals, you have a responsibility to check in because you're putting yourself at risk by not doing so. It means it's harder for us to identify you, contact you, and give you the right advice as to what action you need to take. So we cannot afford to get complacent. New South Wales figures are getting worse. They have themselves said that this will peak in October. So let's not risk it. Make sure you're checking in, you're getting tested and you're getting vaccinated. Lastly, so we do have a number of sites opening for testing over the weekend. I want to mention, in addition to the ones that we posted yesterday, please people check the website for exposure sites and also testing clinics. Sullivan Nicolaides are setting up a drive-through clinic at Logan River Parklands at Beenleigh. It'll be operational today and tomorrow from 9 to 4. So there are many sites open this weekend on the south side. So please check the Queensland website for the closest testing clinics to you. And also, if you see really long lines and you know there's other testing clinics nearby, by all means go to those as well. I'll now hand over to Dr. Young to just go through these cases a bit more.
you, Minister. So yes, we have one new community acquired case, which is that 4-year-old child who lives down in that Bingley area. So it's really, really important that anyone who lives in that Bingley, Logan, Upper Gold Coast area, any symptoms at all, please come forward and immediately get tested. And could everyone make sure they're wearing masks? This is a really high risk period for us, but if we manage it, and we know we can manage these things, then it'll work through. But I have now asked for 100 families that attend the same childcare centre as the child has been at to go into home quarantine for 14 days, and they're all getting tested, of course. And then I've also asked for more than 960 families who attend the Windaroo State School, because 30 of those children go to the before and after school care. So I've asked over those 960 families to go into quarantine for 14 days while we work out what the risk is. So I'm fairly comfortable that we have the risks from the child probably covered by having the school and that early learning centre go into quarantine. I'm very grateful to all those families for doing that. I am more concerned about the Bingley marketplace. So the truckie attended there Monday morning. So last Monday morning, and was there while infectious. And he did go into that Stylish Now salon for 45 minutes. So we're working with the owners of that salon, who have been very helpful, to work through who else was there while he was there. Unfortunately, people didn't use the check-in app. One person did, which is excellent, so we've got hold of them, but we're having to work through who the other people who were there at that time. Similarly, 600 people checked in to the Bingley marketplace. They have 900 car spots there, and they have over 30 shops. So I'm concerned that not everyone checked into that shopping centre. So please, anyone who was there last Monday morning, I need you to come forward and get a test and isolate till you get a negative result. That's really important, because we know that it can be fleeting transmission that leads to transmission of the Delta variant. So I am concerned about the people who attended that shopping centre last Monday morning. So that's very important. But for everyone, it is really important. Any symptoms at all, please come forward and get tested. Then the other thing is we need to increase our vaccination rate. We've done really well till now, and 1/3 of all eligible Queensland adults, that is Queensland adults 16 years of age or older, are now fully vaccinated. That is fantastic, but we need to go and do more. New South Wales has said they don't think their outbreak will peak till October, so they are expecting more cases every day. And we know the risk is that those people can move into Queensland. We've seen it now with a number of truck drivers who, although they're trying to do the right thing, this truck driver has led to a case and potentially more. So we need to be prepared, and the best way to be prepared is to be vaccinated. So please, anyone 60 years of age or older, could you please immediately, if you haven't had your first dose, immediately go and see your GP or go to a pharmacy and get vaccinated with AstraZeneca. We have plenty of supplies, there is no shortage. So could you do that immediately? If you've had one dose and it's 12 weeks since you had that first dose of AstraZeneca, go and get your second dose. We know with the Delta variant you need 2 doses to be protected. So that's critical. If you are 16 years of age or older, please either go and see your GP if your GP is offering Pfizer, or talk to your GP if you want to have AstraZeneca. We know that GPs are now getting bigger stocks of Pfizer than Queensland Health is getting. So there are GPs out there with Pfizer. Please go online and find out who they are in your area and get vaccinated. That's really important. Now, if you don't have a GP you can access to get Pfizer, then make an appointment to come and get a vaccine at one of our Queensland health clinics. We're opening more and more every single day across our whole state, and there are more bookings available. So register, and then we'll be able to give you a booking so you can come and get vaccinated. If you've had one dose of the Pfizer vaccine, then 21 days later you should be booking in for your second dose. That's really important. And as we can gradually open up more capacity, we will be looking at walk-in. At the moment we want people to book. My reason being that I want to use up every single slot. So sometimes when you open up to people walking in, you then have gaps there because you don't always have the people turning up. So at this stage, we are still pushing ahead with bookings because we want to use up 100% of our capacity. But also, I know GPs are not using up 100% of their capacity with Pfizer. They have got spare doses. So please make sure you check whether your own GP has got Pfizer or a GP in your area. We must do this going forward. This is what will protect Queenslanders. Thank you. No. This 4-year-old is the daughter of an administrative officer who works in the booking, in the truckie area that the truck company is managed out of, and they're also close family friends. So no, it is not the daughter of the truck driver, but it is a close contact. Well, so far the others have all tested negative. So this child was tested because they were a close contact of the truck driver. That's why they were tested.
Are you still waiting for a large amount of results from all those families?
Yes.
Today? Do you have a rough figure?
Well, we've got around 100 families who attend that childcare centre. And we've got 962 families who attend the Windaroo State School. So we're waiting on those.
I guess, and in terms of lockdown, would that depend on those results?
Yes. I am very, very concerned because we have had this transmission. So, and I know from the CT value of the truck driver's test result, he had a lot of virus there. The child didn't. So I'm actually less concerned about the child, and I think we have that in hand in terms of having locked down that childcare centre and the school. So I'm genuinely less concerned. And also, they were a contact, so we got to them quite quickly. Whereas the truck driver, we only just found out about. So we've only had that period, and he was infectious in the community for a time period. So he is the bigger concern.
Does he have Delta?
Oh, yes.
Yeah.
Yes. Yeah. Oh, yes, unfortunately. I just hope that we get everyone. So we've been working very, very closely with the owner of the nail salon, and we've been looking at CCTV footage. We've been trying every way we can to find those people who attended that nail salon. That's critical. So anyone who was there on that Monday morning, I need them to come forward.
How many cases would it take to come back potentially with something new, or tomorrow morning would be due to a lockdown?
Well, it depends on the cases. As I'm trying to say, I'm actually not as worried about this child because it's in hand. We've got it under control. It depends if we find cases who went to the Beenleigh marketplace and have then since then been out infectious in the community in an uncontrolled situation, then that would lead me to think that we need to consider a lockdown. The thing is, it is a good thing. It's not good for the family, so I don't want that misinterpreted. I'm sorry that this 4-year-old child has got sick, of course I am, but it's in a controlled situation. 4-year-old children don't go out in the community by themselves. They go to childcare, and that's where this child has been.
Can the NRL go ahead with spectators this weekend?
So far there's no restrictions on any stadiums, any events. We are not changing the level of restrictions in Queensland other than in the Logan LGA area we are restricting visitors around hospitals, aged care and disability facilities. So that's a normal process when we are concerned that there may be community cases. That's the only restrictions we've put in place. The next 24 to 48 hours is critical here. We need to test as many people as we can, and we need to ensure that we quarantine those people. And that's why when we saw with the Indooroopilly case, we're able to find the families and quarantine them very quickly. When we don't have check-in data and we are waiting for people to come forward and tell us they've been to a place, that's where we lose time. So I cannot reinforce enough the importance of the check-in data and everyone checking in, but please, everyone get tested who has any symptoms whatsoever. This is a really important time and we need people to stay safe, so we want people coming out and getting tested in good numbers this weekend. Last one. So look, I have seen a number of cases reported today of people coming forward telling their stories of wanting to come to Queensland. We understand that. We know the hardship that border closures and lockdowns. Remember, the only reason we have a border closure is that New South Wales, ACT and Victoria are in lockdown. Every single state and territory on the east coast mainland of Australia, other than Queensland, is locked down. And so those are people in those areas shouldn't be moving around. Now, if you're coming here to relocate or you're coming here because you're a Queensland resident, then yes, or you've got exceptional circumstances, you can be applying to come to Queensland. Our amazing exemption team is working as hard as they can, reaching out to everyone who makes an application and working through their issues. But I do want to just give a couple of examples why this is really complex, and I ask people to be patient, but I also ask people to follow the rules when they're granted exemptions. We require people to fly in for good reason. We cannot have people driving through hotspots interstate and spreading it potentially through other suburbs, going through towns that have positive cases, going through towns that have positive sewage, going into our border zone and then crossing over by car and potentially stopping elsewhere along the way. That creates very significant risk, which is why we've always said when you get an exemption you need to arrive by plane. But also we have got people, including stories today, that were granted an exemption back in mid-July to fly from Victoria to Queensland. Now, people have chosen to not utilise that exemption, which means they would already be in Queensland and they would be enjoying our beautiful lifestyle right now. Instead, they jumped in their car and drove through 3 jurisdictions that are currently in lockdown and put themselves and the rest of the community at risk. When you get to that border, you can't then automatically assume that you're going to be allowed in. We have an obligation to keep the community safe. So we understand the hardship. We ask for people's patience. We will reach out and work with people about their applications for exemptions. I'm very pleased that we've got rooms opening up. Some more hotel rooms will be opening up throughout the week to get more people into Queensland. Yeah, I can't talk about particular circumstances of individuals and their cases. I don't have her case in front of me in relation to her health conditions. We have clinicians, psychologists who sit in those exemption teams who work through those issues to work out the suitability of whether someone should be in hotel quarantine or whether in fact they should be cared for in our hospitals because their health state is such that they need that level of care. But we do need to make sure that we're keeping the whole community safe, not just the individuals who are wanting to come into Queensland. So we will work with that individual. I'm happy to get her details from you when we finish the press conference. And if she hasn't contacted us, we'll make sure we reach out to her. But otherwise, I will follow up with the exemption team where that particular case is at. But I do want to... So any children, can I say, any children who are separated from their parents will be allowed to come back to Queensland and quarantine at home, but their whole household will have to quarantine with them, just to ensure... Well, I want to check the details. It's not always correct when people are saying they've been knocked back. What they've been granted is the right to come into Queensland, but no, we've got people who have been granted exemption but still don't want a hotel quarantine. So, well, I'm happy to look at the individual cases, but remember, we've got hundreds of people applying a day to come into Queensland. Why? Because we are not locked up as a state. We've got I know, I've just said all Queensland children wanting to come back into Queensland will be allowed to quarantine at home and will have to quarantine with the whole household. So I'm giving that guarantee right now. We are going through all of the applications to identify these children. If people have not put in a formal application, if they've simply rung the phone line, have not put in an application, I encourage you to do so immediately, so that we can make sure that these kids can get home to their parents and make sure they're safe and home quarantining. Thank you.
Just on home quarantine.
Thank you.